Hi there, Karen from Proactive Pelvic Health Center. Let's chat about pregnancy and how fear can play a role. Of course, it's totally normal and natural to feel nervous during pregnancy. Are you eating the right diet? Are you exercising enough? Are you exercising too little? Are you doing enough to keep the baby healthy? However, if fear becomes pervasive enough, it can have a negative impact. From a recent study, several themes have emerged, including the fear that you're harming the baby, the fear of pain, the fear of the unpredictable, the fear of the birthing process or not being successful with it, and the fear of the loss of control or not being able to participate in the decision-making process. If fear is pervasive enough, it can have a negative impact on your emotional health, and this increases your risk of developing lumbopelvic pain, having a longer lasting labor, as well as having more interventions during the delivery process, including a cesarean birth. They also found that people who have less fear associated to pregnancy and delivery, or feel that they have more control over their decisions, have the highest rate of unassisted vaginal births. The good news is that if you feel like you're somebody who has a lot of fear about pregnancy and delivery, that can change. If you're not sure where to get started or how to start on this road to having less fear, a great place to start is seeing a pelvic floor physiotherapist. But how will they help? They will try to understand your fears, attitudes, and beliefs, educate you so that you can gain more knowledge about the birthing process, and empower you by highlighting all of the abilities that you have in the decision-making process. We are here to optimize your birthing experience and pregnancy.